Hello and welcome to the topic What is stress for the students of medical science? Introduction. Every one of us experiences stress in some way or the other. In fact, stress is a universal phenomenon. However, the way we respond to stress makes all the difference to our overall physical and mental health. Definition of stress. Stress can be defined as any type of change that causes physical, emotional, or psychological strain. Why is knowledge of stress important? Developing a clear understanding of how stress impacts our physical and mental health is important. Signs of stress. Stress can be short-term or long-term. Both can lead to a variety of symptoms, but chronic stress can take a serious toll on the body over time and have long-lasting health consequences. Some common signs of stress include difficulty sleeping, digestive problems, dizziness, feeling anxious, changes in mood, sweaty palms, muscle tension, especially in the neck and shoulders, racing heartbeat. Reference: Cleveland Clinic. Stress. How to identify stress? If you think stress might be affecting you, there are a few things you can watch for. Number 1. Psychological signs such as difficulty concentrating, worrying, anxiety, and trouble remembering. Number 2. Emotional signs such as being angry, irritated, moody, or frustrated. Number 3. Physical signs such as high blood pressure, changes in weight, frequent colds or infections, and changes in the menstrual cycle and libido. And number 4. Behavioral signs such as poor self-care, not having time for the things you enjoy, or relying on drugs and alcohol to cope. Causes of stress. There are many different things in life that can cause stress. Some of the main sources of stress include work, finances, relationships, parenting, day-to-day inconveniences. Stress can lead to some unhealthy habits that have a negative impact on your health. For example, many people cope with stress by eating too much or by smoking. These unhealthy habits damage the body and create bigger problems in the long term. Reference: American Heart Association, Stress and Heart Health. Types of stress. Some of the different types of stress that we might experience include acute stress. Acute stress is a very short-term type of stress. This is the type of stress we most often encounter in our day-to-day life. Number 2, chronic stress. Chronic stress is a stress that seems never-ending. It is inescapable, like the stress of a bad marriage or an extremely taxing job. Number 3, episodic acute stress. It seems to run rampant and be a way of life, creating a life of ongoing distress. Number 4, eustress. Stress is fun and exciting. It is known as a positive type of stress that can keep you energized and motivated. It is associated with when you are skiing or racing to meet a deadline. Impact of stress. Stress can have several effects on our health and well-being. It can cause diabetes, depression, anxiety, lack of motivation, exhaustion of physical or emotional strength. Treatment for stress. Stress is not a distinct medical diagnosis. There is no single specific treatment for it. Treatment for stress focuses on changing the situation, developing stress coping skills, implementing relaxation techniques, learn to recognize the signs of burnout, try to get regular exercise, take care of yourself, practice mindfulness in your life. Some interventions that may be helpful include therapy, medication, and complementary and alternative medicine. At the end, what I can say is that try to be stress-free in your life to the extent possible by engaging yourself in productive activities. That's all we have. Hope you understand the concept. Thank you and goodbye.